Good morning. My name is Melissa Rosales. I will be doing the reading presentation on the article, The Cost Conundrum, What a Texas Town Can Teach Us About Healthcare. The article was published June 1st, 2009 by Atul Gawande. So we will get started on the overview. Some article points that I want to make is where the most expensive healthcare markets are in the country. What is the reason for such an increase in cost? When has the increase taken place? Who's responsible for the increase? And have there been any changes since the article? So we start off with the location. Where's the highest healthcare cost? And the highest healthcare cost is in McAllen, Texas. For those of you that are not familiar with McAllen, Texas, I have it is in part of Hidalgo County and it's located in the Rio Grande Valley. Here's some fun facts that I have listed as well. It has the lowest household income in the country. It calls itself the square dance capital of the world. It's a border town. Lonesome Dove was set here. Year-round temperatures are pretty hot and humid. Tourism is high due to the near proximity of the Gulf of Mexico and Mexican border, and it's home to Tex-Mex food and Whataburger. So where's McAllen, Texas? It is about an hour and a half from the most southern tip of Texas and about 5 miles to the Mexican border. And I've included a couple pictures in the slide. The article starts with Medicare expenditure in 2006. It states that in 2006, Medicare spent about $15,000 per enrollee, and gave an example of the average person has an earning of $12,000 a year in McAllen, and Medicare spent about $3,000 on top of that. It also stated in the article was President Barack Obama's speech said in a March speech at the White House, by a wide margin, the biggest threat of our nation's balance sheet is the skyrocketing cost of health care. So the author wants to start his search, or he starts his search looking for why. He traveled to McAllen to search for his answers, and as soon as he landed, he started interviewing people. He interviewed a police academy cadet at a McDonald's, and just asked them the question of why he thinks healthcare costs are so expensive in McAllen. The cadet said, just look around, people are not healthy here. McAllen, with its high poverty rate, has an incidence of 60 heavy drinking 60% higher than the national average, and the Tex-Mex diet has contributed to a 38% obesity rate. So was it because of the obesity rate that the healthcare costs are so high? Well, public health statistics, show that cardiovascular disease rates in the county are actually lower than average, probably because its smoking rates are quite low. Rates of asthma, HIV, infant mortality, and cancer are also quite low. There was a comparison. He compared to El Paso, which is 800 miles up the border and has essentially the same demographics. Although in 2006, Medicare expenditures in El Paso were 7,504 per enrollee, about half as much as McAllen. So he continues, and then he starts he made his way to the hospitals there in McAllen, and he started meeting with physicians. He met with Robert Allen first, a Houston-trained general surgeon. They walked through the doctor's hospital at Renaissance in Edinburgh, and the tour consisted of the doctor showing him the high-tech equipment, the flat screen video monitors, built-in imaging equipment, the surgical robot for minimally invasive robotic surgery. He moved on to McAllen Medical Center, where he saw an orthopedic surgeon work under an operating microscope to remove a tumor that had wrapped around the spinal cord of a 14-year-old. And he continued. He also watched Dyke and a team of 6 do a coronary artery bypass using technologies that didn't exist a few years ago at McAllen Heart Hospital. So there was no evidence that the technology and treatments at McAllen were far better than anywhere else in the country. And The annual reports that hospital files with Medicare show that those in McAllen and El Paso offer comparable technologies. So could it have been the quality? The care of McAllen does not stand out for its quality. Medicare ranks hospitals on 25 metrics of care, and on all but two of these, McAllen's 5 largest hospitals performed worse on an average than El Paso. So his findings were answers were pure and simple. The author continued to meet with McAllen doctors. One night he went out to dinner with six McAllen medical doctors, and he asked them the same questions. He gave them the medical um, um, he told them that McAllen had the country's most expensive, was the most expensive place for healthcare. He provided them with spending data for Medicare. He told them the average cost for the Medicare, enrollee was 4,891. But since then, that the cost for healthcare had skyrocketed more than any other market in the country. One doctor said maybe the health service is better. Another said it's malpractice. And the general surgeon finally said, come on, there's overutilization here. It's pure and simple. Dr. C said, we're racking up the charges with extra tests, services, and procedures. The general surgeon continued to state that the way medicine was practiced has completely changed. Before, it used to be based on how good you do a job, and now it's how much you'll benefit. Um, Finally, the author got an answer to what he was looking for, that it was not because of patient demographics or better healthcare and technology, but overutilization in tests, services, and procedures. So we continue to move on. Lessons learned. The findings, the author continues to search a little bit more beyond the overutilization problem. He met with top managers, the doctors at Hospital Renaissance, and asked them the same questions. An anesthesiologist at the hospital gave a theory and a history of American healthcare financing going back to Lyndon Johnson and the creation of Medicare, and said that government was a problem in healthcare. Government insurance programs like Medicare don't pay enough, and the government programs are full of waste. The author continued to search for more on the high costs and spoke with a marketing rep for a McAllen Home Health Agency who told him of the process uncannily similar to what Powell found in biotech. Her job was to persuade doctors to use her agency. She described how a decade or so ago, few early agencies began rewarding doctors who orders home visits with more than trinkets. They provide tickets to professional sporting events, jewelry, and other gifts. Other agencies jumped in. Some began paying doctors a supplemental salary, such as for medical directors for steering business in their direction. So people were getting incentives. Or the author talked to also Dennis Cortese, the CEO of the Mayo Clinic, which is among the highest quality, low-cost healthcare system in the country. Some things that stood out during a visit to Mayo was how much time the doctor spent with her patient. The patients required 20 minutes, but one patient in particular had colon cancer and other complex issues, including heart disease. The physician spent an hour with the patient and even called a cardiologist with a question that he had about the patient. The cardiologist went up to meet with a physician, and 15 minutes later, he met with the physician. The core tenet of the Mayo Clinic is the needs of the patient come first, not the convenience of the doctors or the revenues. The doctors and nurses, even the janitors sat in meetings almost weekly, working on ideas to make the service and care better, not to get money out of patients, which I found was extremely important for these meetings to be held. So communication is the same at any level in the hospital. So it's a question is, how is this possible in Mayo? Decades ago, Mayo recognized the first thing is needed to do was to eliminate the financial barriers. It pulled all the money the doctors and hospital system received and began paying everyone a salary. So the doctor's goal in patient care couldn't be in increasing their income. Mayo promoted leaders who focused first on what was best for the patients and then on how to make this financially possible. Their aim is to raise quality and to help doctors and staff members work as a team. Another one of the lowest cost markets in the country is Grand Junction, Colorado, which had received some of Medicare's highest quality of care scores. Doctors agreed years ago to a system that paid a similar fee whether they saw Medicare, Medicaid, or private insurance patients, so that there would be little incentive to cherry picking patients. So some points that I want to make, some last points. He continued to go on. The last point the author makes is vital. He met with activists and policymakers, and he got their opinions as well. The lesson of high quality, low cost communities is that someone has to be accountable for a total quality of care. Otherwise, you get a system that has no breaks. You get a McAllen. This article was published in 2009, and since then, it's a little outdated. So since then, um, there was another article that was published 10 years after the cost conundrum. It was published by Steve De La Ronde, which states that 10 months after Gawande's article, the Affordable Care Act was signed into law on March 23rd, 2010. He Gawande revisited McAllen 6 years later when he published Overkill in 2015. He discovered McAllen had changed. From 2009 to 2012, costs had decreased by an average of $3,000 per Medicare recipient, and there had been a 10% reduction in hospital admissions and a 40% in spending for both home health services and ambulance rides. He acknowledges that changes in physician behavior had initially occurred due to an increased scrutiny and the threat of more negative publicity and lawsuits. However, he credited primary care and the debut of the Accountable Care Organization as a force that maintained the change. The best way to reduce unnecessary care may be the promotion of a medical culture that is not only patient focused, but also enables physicians and medical staff to work together as a team. How does this tie into the chapter readings? Um, Problems with poor quality patient care data. This article demonstrates an example of a serious consequence of poor quality patient care data. What can happen when there's problems with poor quality patient care data? You get a diminished quality. What can happen with can lead to problems with patient care, communication among providers and patients, documentation, reimbursement, outcomes assessment, and research. The author concludes a reason for high health care costs is because of overutilization. Excuse me. That may have been the case, but the issue could have been pinpointed with proper quality patient care data and conforming to a recognized standard. Although there's no universally recognized set of healthcare data quality standards in existence today, two organizations have published guidance that can assist a healthcare organization in establishing its own data quality standards, the Medical Records Institute and the American Health Information Management Association. How can I apply what I have learned in this article to on-the-job situations? I can make sure that I have a complete understanding of healthcare data and information and recognize the importance of ensuring data quality in my job. And lastly, here are the references that I listed. Here is the cost conundrum, the article that was published 10 years after the cost conundrum, and the book or the readings in this week. And if you all have any questions, please feel free to ask. Thank you for taking the time to listen to my presentation.